Welcome to the recording of the webinar hosted on January 25th, 2017, introducing the North Coast and Haida Gwaii Aboriginal Health Improvement Committee. On the day of the live webinar, Semagul Fanny Nelson, a matriarch and elder from the community of Metlakatla, opened the webinar with a prayer in an acknowledgement of the traditional territories. This recording has three separate channels, the first being the introduction to Aboriginal Health and Northern Health that hosted the webinar along with the North Coast and Haida Gwaii Aboriginal Health Improvement Committee, which includes some information on Aboriginal health, the AHICs, and the cultural resources being developed by those AHICs, the Aboriginal Health Improvement Committees. The webinar also featured the video production Honoring Our Journey, which was produced by the North Coast Aboriginal Health Improvement Committee, and also includes some questions and answers by panelists from the North Coast Aboriginal Health Improvement Committee on the day of the webinar. And we begin with an introduction to Aboriginal Health in Northern Health.
Aboriginal Health in Northern Health has several priorities, and you're welcome to visit our website, and we'll provide some links as we move through here. But a central part of our work is enhancing cultural safety and cultural humility in all Northern Health programs and services. We undertake knowledge translation activities and initiatives and have quite a suite of really nice informative publications and otherwise that you can access through the website. We support and implement evaluation strategies, and so we recently had an external evaluation completed on our department itself, and also very much in partnership with the First Nations Health Authority, the FNHA, as you can see the acronym there, implementing the Northern First Nations Health and Wellness Plan and related activities in the context of the partnership that we have with the First Nations Health Authority. So the Aboriginal Health Improvement Committees, that's a bit about Aboriginal health itself, and I've got a map coming up here. There's 8 Aboriginal Health Improvement Committees throughout Northern Health. And if you're not from the Northern Health region, it's a vast geographic area covering about 2/3 of the province of BC. And so through that, we have 8 Aboriginal Health Improvement Committees with a diverse membership. And here's a map coming here that very roughly shows where those Aboriginal Health, the geographic area in which they cover. The green placeholders in the middle are roughly sort of what would be the administrative center for some of the Aboriginal Health Improvement Committees, for lack of a better term, and that's where the main hospitals are located. And if we start from the east, we can see that there's the Northeast AHIC and through the Prince Georgian area AHIC there in the middle, and all the way through to the North Coast AHIC, which is the furthest to the west, covering Haida Gwaii and part of the North Coast, including Prince Rupert and those communities. So that gives you a bit of information about where geographically the AHICs are situated and the work that they do in those areas with the communities all through that area. And so the committees themselves, with the new slide coming up, the membership on those committees comes from a range of areas. And so Indigenous communities and organizations are represented on there often through the health directors or through other staff. There are staff from the First Nations Health Authority that participate on the AHICs, with the community engagement coordinators being central to that, as well as local Northern Health leaders. So for example, Michael Melia, the Health Services Administrator for Northern Health out on the North Coast in Haida Gwaii and Prince Rupert, serves on the North Coast AHIC, and some other sectors are represented in there. And these AHICs have been around within Northern Health since the early 2000s and have just done some really great work. They meet regularly to collaborate on a variety of issues, just identifying priorities in areas and in communities, working on a range of issues and opportunities, looking towards solutions and engaging in discussion about approaching those. So that's a little bit of background on the overall AHICs within Northern Health, all 8 of them. But today, our work here today is focused on introducing the North Coast AHIC. And this webinar series that we're working on, this is actually the first, and welcome to our first. And our goal over the next 18 months or so is to introduce each of the AHICs through a webinar process. And the North Coast AHIC has been fantastic in being first off the mark here, and we've been working over the last couple of months in setting this up and having some discussion. So I'd like to introduce some of the communities in the North Coast AHIC. And you can see here the Indigenous communities listed, as well as 2 of the quote-unquote urban centers. And we've got, I will start from furthest to the southeast on that map. So the blue placeholder there sitting over top of Hartley Bay and the Gitgat Nation. And the community of Hartley Bay And one thing I'll make clear, and we were discussing, for those of you that are not familiar with these communities, is there's no roads. This is all plane and boat access. And so the community of Hartley Bay is one of the furthest away from the area of Prince Rupert, and can be accessed either by the ferry, which goes a couple of times through the week with a schedule that does vary between different communities, or float plane, or personal watercraft, a boat going in, or water taxi. But it's several hours south of Prince Rupert, so to give you an idea of the realities in a healthcare setting of what that looks like for the community of Hartley Bay. Moving north from Hartley Bay is the community of Kitkatla. The blue placeholder you can see over top of that, which is located almost straight south of Prince Rupert, which is the green placeholder. And Kitkatla has a population of approximately 400 people. The community of Hartley Bay has a population of approximately 150 people. And Kitkatla, similarly to Hartley Bay, accessed by ferry, by boat, water taxi, or float plane. And then as we move further north, we've got the community of Prince Rupert, and just a little bit to the west is the community of Metlakatla, where Fanny comes from, and that population in Metlakatla is approximately 80 to 100 people. And then a little bit further to the north from Metlakatla, we have the community of Lax Kw'alaams, which is also sometimes known, or known in the past, as Port Simpson. And the community Lax Kw'alaams has a population of approximately 80 to 1,000. And I've heard from various folks as we've been chatting about this, that populations do fluctuate at different times of the year and for different purposes, and especially for big events like the All-Native Basketball Tournament in Prince Rupert every year. Moving to the west, I'll introduce the last two communities, which is actually where I grew up on Haida Gwaii. And we have furthest to the north, the community of Old Masset, and that is a population of approximately 700. And Masset and Old Masset are joined by a highway that runs between there down south to the community in Skidegate and Queen Charlotte City. So we have the other Haida Nation community of Skidegate located to the south in the blue placeholder just north of what you can see on the map, the Sandsbit. And both of those communities, approximate populations around 700. And then moving back to the green placeholder is where we've got Prince Rupert and Port Edward. And so in each of those communities is a nursing station, small health center, and then there's 3 hospitals that service this AHIC area. There's the main one in Prince Rupert, the Prince Rupert Regional Hospital, and then a smaller facility in Masset, close to the community of Old Masset, and then the new hospital built in Queen Charlotte City, just to the west of Skidegate. And so those are the 3 healthcare facilities to give you an idea of where we're placed. So that gives you an introduction of our North Coast AHIC. And moving into introducing our video that we're going to be watching today, the Aboriginal Health Improvement Committees have been doing some really fantastic work over the last several years and developing what have been called cultural resources or local cultural resources. The slide's just coming up for you here. And there's a booklet. There's been over 30 of these cultural resources developed throughout all of the AHICs, many of them with great diversity. And the booklet that you can see there, the local cultural resources, is available on our website and something that we often have in hard copy. And the purpose of those cultural resources being developed by the AHICs was really guided by a question from the Vice President of Aboriginal Health, Dr. Margot Greenwood. And she had asked the AHICs a few years ago, if I were a new health practitioner coming to your community, what would you like me to know? And so that question has been passed out to the AHICs. The AHICs have had various meetings and discussions about this, and I'm sure that the panelists will be happy to talk more about this and their experiences with the AHIC once we show the video. And the video that we're featuring today, honoring our journey, is one of the cultural resources that was developed and produced by the North Coast AHIC. And it's just a fascinating, fantastic production, and you can see a few of the images there. And I'm going to play it shortly. But before I play it, I do want to pass along that there can be some technical challenges in terms of showing a video through the webinar platform. And so depending on your internet speed out there, that's really going to guide whether you're going to be able to watch the video through the webinar platform. But what I'm going to do, and it should already be a link to it in your questions pane, and if not, I'm going to send it out in the questions pane so that you have a link to the video on YouTube. And therefore, if there's any issues when you're trying to watch it through the webinar platform, you can simply just either close down the webinar platform and then be able to watch the video from outside. I'm seeing somebody sending me along here that the link is not there. So I'm just in the process of sending that out so that you can have it to the entire audience, the YouTube link, and then that way you can link into it and be able to watch it there. So as mentioned, it's about 26 minutes, a little bit more, and what I'll do is provide a little bit of space once the video is done playing to be able to allow people to sign back in if they had to sign out. And I will tell folks, and I'm looking here at my attendees panel to see how many are coming in by phone, that unfortunately if you have come in by phone, my understanding is that the sound will not play through. And so please do sign on to your whatever web browser you use and watch the video there. And with that being said, I'm going to switch us over to having the video play within. It'll start shortly. And please do send us your questions and comments as the video is playing or shortly after, and I will then start a discussion with our panelists after that to be able to answer some of your questions and have some discussion about it. Hope you enjoy the video. Speak with you shortly.